show.
As Canadians continue to struggle with high rates of mental illness and shortages of specialists such as psychologists, the Canadian Psychological Association has released a report entitled Increasing Access, Reducing Cost, and Improving Outcomes, Maximizing Psychologists' Contributions to Canada's Publicly Funded Healthcare System. Despite strong evidence supporting the effectiveness of psychological care, only a small portion of the thousands of psychologists in Canada practice within our publicly funded healthcare systems, leaving many Canadians without access to their expertise. In response to these pressures, the report outlines 5 key strategies to help close critical gaps in access and ensure those in need receive timely, cost-effective, evidence-based psychological care. We're really lucky to have with us one of the report's authors, Dr. Lesley Graff. Lesley, I should tell you, one of our fan favorites here on VOCM is your incoming president, Janine Hubbard.
Wonderful.
And we love Janine, and she and I have oft talked about what can be done to help Canadians get more psychological care. So it's very timely to be talking to you about this report. What spawned the report, Lesley, before we get into the key strategies?
Well, thanks so much for your interest, Tim, and for the interest of your listeners. Over the last few years, Canadian Psychological Association has been bringing together psychologist leaders and healthcare from across the country, because I think everyone is looking at their own small corner of the world and noticing challenges keeping psychologists in the publicly funded health system, increasing mental health concerns through the pandemic and past that. And in getting together, realize that we're actually seeing a lot of commonality. It's not something unique to this pocket in Alberta or this pocket in Newfoundland, for example. And so from those essentially think tank meetings to compare notes, it really moved to we need to move beyond comparing notes to looking at what needs to be done and what action could be taken.
Yeah, one of the things Janine and I have often talked about is how in certain provinces like Ontario, there's the issue of trying to fast track around credentials, and that's controversial. Right. But you have 5 key strategies. Tell us about those strategies.
Yeah, the first one is to really utilize the psychologists well who are in the health system. Psychologists are really only accessible publicly if they're in funded roles in the health system, and otherwise one has to pay out of pocket for them because psychologists are not part of what are called insured services, where we can access physicians. And so really critical that you can find them in the health system. And so utilizing those skill sets well, psychologists are sort of deep experts in diagnosis and in treatment and treatment planning. So that's one step. A second step is to retain the psychologists in the health system. You had said in your intro, and our report certainly flagged that only a small proportion of the thousands that are trained and working in the country are actually in the publicly funded health system where they can be accessed. And it has to do a lot with work conditions and remuneration. And so that we really need to sort of tip the balance and make those roles more attractive across a number of ways. Third recommendation is around training, and if we look at the response to not enough physicians is the medical schools across Canada are increasing those training seats. That just hasn't happened in the same intentional way with psychology. So we're really quite behind, and even the numbers we're training to replace an aging workforce, much less the numbers we need for really an exploding mental health needs. The fourth one is around utilizing the research that psychologists generate. And because that psychologists are often multipliers, it's not just who we see on a day-to-day basis, but also research that psychologists do helps to figure out how to reach out to more individuals, how to be more effective and efficient with therapies. And so utilizing that research can then really improve not just what psychologists deliver, but others who might be involved in that mental health care. And the last recommendation is we clearly need a bit of a louder voice from the public and also from our provincial associations to improve the awareness to the decision makers like governments around funding.
So what role, Lesley, do you see for the federal government and the provinces there, appreciating that often money for healthcare does come from the federal government, but it is the provinces and territories who deliver healthcare? What role for those various governments?
Yeah, and I appreciate that question too. I mean, the federal government often, sets the tone or sets some priorities around health, and they did do some significant funding around mental health to provinces. But then how that translates down, you're right, is really at the provincial level. So I think Canada in general is sort of an underspender on mental health relative to other countries, and so that can be where I think there can and should be sort of federal priority setting around strengthening the proportion of health budget that goes to mental health. But then it is at the provincial level that governments make those decisions about what they're going to be funding. And of course, it's at the provincial level that we deliver health services. And so it really becomes key that at each province's level, they're looking carefully at their mental health investment, and the health providers and the specialists who can deliver that care that sort of makes a difference, is effective, is lasting.
Last one for you. You've talked about the role of your provincial and territorial associations. We've talked about where governments can play a role, but what can we, the public, do? And I say this because often the stories we report are when somebody can't find a psychologist, somebody is struggling because they're in a dire state of mental health and wellness, and we talk about there not being anybody there to help them, or they went to an emergency room and there wasn't somebody who was as well trained as perhaps you are in certain issues to help guide them. So what can the public do here, Lesley?
Oh, I really appreciate that question, too, as a practicing psychologist and someone who's been in leadership in the health system for a number of years. Governments listen to the public. I know sometimes public doesn't think that's the case, but our MLAs, and if you're a constituent, you go to the government, because it's one thing for psychologists to say you need more psychologists in the health system. It's quite another for the public to say, here's my story, here's the issue, and to really demand that they have access to well-trained health professionals like psychologists, because mental health in particular it's not as concise as surgery, right? So you really want, and there's huge challenges if you don't have someone who knows what they're doing and can really bring the care. So really speaking up as public, I think it's hopefully easier now to talk about mental health and one's own challenges or concerns, and bring those to the attention of government and say, we want and we need more psychologists in the system, and what are you doing about it with my taxpayer dollars?
So very well said, Dr. Lesley Graff. Thank you for your time. And I will say this about Dr. Hubbard. She is an excellent advocate, and she will add to what already is strong advocacy work by the CPA. Thank you for joining us. Thank you for the report. Appreciate your time this afternoon.
Thanks so much, Tim, and I wholeheartedly agree about Dr. Hubbard. We're delighted to have her coming in leadership at CPA.
All right, nice to chat with you. Take care, Leslie.
All right.
Bye.
Good to talk with you as well. Bye-bye.